Chatbots certainly show promise in providing healthcare services. They are a growing AI tool. One example I would like to take a few minutes to look at is Ada Health. It has over 3,600 conditions in its database, covers 99.5% of all diagnosable medical conditions, and analyzes over 10,000 symptoms and risk factors. As of 2024, it is one of the most popular healthcare chatbots in the environment. This chatbot is widely recognized and guides users to appropriate medical care if necessary. But have we really looked at how it's going to impact nursing and how we can integrate it into our academic platforms to help that ready environment? Let's take this opportunity. Let's do the symptom check challenge. I'd like to encourage all of you at this time to download the Ada Healthcare app and work with me to do a simple test. Our goal really is to help familiarize you with this type of AI technology, which is becoming more and more common. And this particular app promotes the understanding of symptom analysis and diagnosis in the digital health context. So as we begin, I would like you to work with teams if you have the opportunity, and we will go over 2 separate case studies. Some things I'd like you to think about as we go through this is how plausible are the diagnoses based on the given symptoms? What additional questions could they ask to help the patient narrow down the diagnosis? How does the app diagnosis compare to my initial thoughts? Other things I'd like you to consider as well is how does this tool fit into your clinical practice? These are the challenges that our nurses of today are having to face, as well as our educators in getting them ready for the next phase. Also think about what are the limitations and benefits of using AI in symptom checking. How could tools like this change and enhance patient interactions? Let's take, for example, a patient by the name of Maria. She's 58 years old, female, high school teacher, hypertension and type 2 diabetes. Medications are metformin and lisinopril. And her symptoms right now are increasing fatigue, shortness of breath, occasional dizziness, and recent explained weight gain. We know that Maria has been managing hypertension and diabetes fairly well, but she's noticed a decline in energy levels, which she's initially attributed to her busy schedule. However, the symptoms have persisted and worsened, prompting her concern. She mentions her symptoms are more noticeable in the evenings and sometimes include swelling in her ankles. So take a moment. Go ahead and put those symptoms in your Ada app. What kind of output are you saying? Do you agree with it? These are many of the same challenges and opportunities that our nursing staff are having to manage as patients are using these tools prior to coming to care. Other things our nurses are having to deal with on a daily basis is working with rip and replace situations with electronic health records. Now that we've explored how chatbots are transforming patient engagement, let's shift a little bit our focus now to EHRs. As we delve into the EHR adoption rates and the strategies for successful transitions, we'll see how these systems not only streamline patient data, but also significantly enhance the decision-making process in clinical settings. Let's examine the current landscape of EHR adoption and discuss how healthcare facilities can navigate the challenges and opportunities for transitioning to these advanced systems. EHR are now a staple in many modern healthcare facilities. As of 2021, nearly 78% of office-based physicians had a system and 96% of non-federal acute care hospitals had adopted. But now we're in an interesting conundrum that many hospitals are now starting to replace, going from electronic record to electronic health record due to inadequate functionality, challenges with interoperability, cost, scalability, integration with other tools. The list goes on and on. So again, yet another challenge that we must work with an academia and our practice partners to help better ready our relationship with vendors to really help nurses get at the forefront of design and capability management. Having explored the adoption and transition strategies of electronic health records, which are vital for enhancing data management and supporting informed decision-making, now let's take a look at another transformative technology that's in our daily lives of our nurses, robotics. The integration of robotics with the insights provided by EHR can significantly enhance nursing care. This integration not only supports the physical tasks associated with nursing, but also enriches the quality of care through precision and efficiency. We will now delve into how robotics is being used not only to assist in complex surgical procedures, as in the Da Vinci surgical system, but also support nurses in daily patient care tasks, such as the Moxie, the Diligent Robotics robot, thus revolutionizing the role and capabilities of nursing professionals in our healthcare system. As we've seen, robotics is playing a pivotal role in enhancing both the efficiency and precision of healthcare delivery. Continuing our exploration of technological advancements in healthcare, let's shift to yet another critical area, and that's of smart pumps. These smart devices represent a significant leap in medication management, ensuring that treatments are not only precise or also safer. We'll discuss how smart pumps integrate with hospital systems to improve drug administration accuracy, supporting nurses in delivering optimal care. Smart infusion pumps, also known as smart IV pumps, have significantly improved the safety of IV infusions. First introduced in 2001, smart pumps infused devices pre-programmed with perimeters for drugs, concentrations, and dosing units. These perimeters are defined locally. Smart pumps can alert users to programming outside these perimeters, potentially preventing adverse medication events. They also provide precise control. Like other infusion pumps, smart pumps offer precise control over dosages and flow rates. They allow healthcare professionals to administer medications accurately, reducing the risk of errors or overdoses. The widespread adoption of most interest is that they're now used in over 80% of U.S. hospitals. Their implementation has significantly improved patient safety and is a key aspect of most nursing training programs. One key feature of our smart pumps is their drug libraries. These libraries contain programmed information about various medications, including dosages, concentration, and safety limits. This, like many of the other technologies I've showed you, are key programs that many informaticians are managing either on the vendor side or within a hospital. Another key issue also is interoperability with these pumps and how they can work with multiple systems. Organizations also can use smart pumps as part of their quality improvement initiatives, while regular review of the infusion data and error reports helps identify for improvement and refine drug libraries. Nurse informaticians certainly have a role to work with pharmacy leaders to help better this option. Another opportunity to help train our nursing informaticists is to integrate them into more and more of what is providing now with virtual reality.